Hey there, my name is Jonathan Friedman, and you are listening to the FAQs podcast by EHN Canada. This is the show where we scour the internet for the most frequently asked questions about mental health and addiction, and ask an expert for their answers to them. Today it is my honor and my pleasure to introduce to you my special guest, Dr. John Rom. Jonathan Rom, him, is a qualifying registered psychotherapist, MD, and public health expert. With his global health background and a focus on adult ADHD, mood and anxiety disorders, Jonathan's primary passion is demystifying counseling and welcoming clients into the collaborative, rewarding work of self-discovery and healing. A little bit of a fun fact, Jonathan and I have hosted 2 other different podcasts together. We can get into that another time. But Dr. Jonathan Rom, how you doing today, my friend?
I'm doing very well. How are you doing, Jonathan?
So good. So glad to have you on the show.
It's a pleasure to be here. Thank you so much for having me and having me for your inaugural episode. It's a real honor.
Absolutely. So, John, this is the first episode. We're going to essentially ask you 5 of the most frequently asked questions about a very special topic. We did a lot of research before the show to see what the people want, what the people are researching, and you're our first expert to tackle those questions. So we're very, very excited to have you. But before we get into that, John, I want to ask, can I call you John? Is that fine?
You can call me John, as you have for the last 2 decades almost.
Yeah, exactly, right? Perfect. Thank you for that. John, tell the listeners a bit about yourself and your journey into the field of psychotherapy. How did you get here?
So there was a time where I was solely focused on medical sciences and medicine, and that's why I did a training in medicine, and I did training in public health as well. And all that kind of culminated in me realizing that the work that I really enjoy the most is working with people one-on-one, talking to them about their problems. There's an element of that is so gratifying when it works and when you feel like you have a breakthrough, that I just wanted that to become my everyday. So I have just recently finished my degree in psychotherapy with Yorkville University. Thank you very much. And I've been practicing now since the beginning of the year. But obviously, I've had my hands in adult ADHD literature and treatment for some time. Throughout medical school, it was both a topic of education and a topic of actually working with people, as well as ADHD coaching that I did between this degree and the last one.
You've been in the world of adult ADHD for a long time, which I think is why today's very special topic is medication therapy and the treatment of adult ADHD. Mm-hmm. And I'm really, really excited about this topic, and I'm really excited to talk to you about it because I feel personally like as somebody in marketing, I'm scrolling through TikTok, I'm exploring mental health, and I feel like ADHD is one of the most commonly discussed topics everywhere. And I think it's really, really great that we're going to be able to take some of those questions people have from the internet and answer them right here with our very own expert.
Absolutely.
So, are you ready to get down to the nitty-gritty?
I was born ready.
You were born ready. Perfect. Okay, so today's topic, as mentioned, is medication versus therapy in the treatment of adult ADHD. And to kick things off with our first question, I really would love to know, what is ADHD? What does it stand for? What's involved in it? What's involved in it diagnostically? How does it affect people? Let's talk about it a little broadly first.
So the attention deficit hyperactivity disorder, it's been around for a little while now. There were early descriptions of it like in the 1700s and then in the 1900s, but the modern definition is sort of this inability to regulate your executive functions. So these are the functions that allow you to moderate how you manage time, how you manage and regulate your kind of emotional input, your ability to focus on a task, your ability to kind of hold still. And all of these executive functions exist within all of us, and they actually exist in other disorders, but this kind of sustained deficit of executive function is the current understood definition. Now, to get diagnosed, there are criteria, at least in this side of the world, from the Diagnostic Statistics Manual, DSM. And
Number 5, right? That's where we're at?
Well, so we're actually at a special edition of number 5, but the difference is that there used to be this understanding that you can start seeing symptoms at 6 years old, and you would see them at 6. The like median age would be 6, and then you would see them in perpetuity, and they would just kind of evolve and change, or they would disappear. Now it's understood that you can start to see them later, like 12 years old, and you'll see these symptoms of being hyperactive or being inattentive or having some combination of the two. Which is why the DSM actually creates like kind of 3 subtypes. If you're mostly inattentive, you have a predominantly inattentive type, or you have a predominantly hyperactive type, or if you have like a melange of both categories, you'll have the combined type.
So there's like attention deficit hyper disorder or combined type attention deficit hyper disorder. It's kind of a way.
And they're all called ADHD, but the manifestations kind of fall into those 3 categories. But to be honest with you, it's such a wide distribution of how it presents that you'll find a lot of commonalities between everyone who presents with it, but you'll also see a lot of kind of specific personality traits mixing with how it shows up. And it also shows up comorbid with like a lot of other disorders. So like it's not uncommon for someone with ADHD to have depression or anxiety or some sort of addictions disorder, something like that.
Interesting. And comorbid means having more than one mental illness or mental health concern at the same time.
That's correct. Yeah, and comorbid illnesses is something to look out for in psychiatry and in psychology and in psychotherapy, because it really affects like how you want to approach the treatment. It's something you have to keep at the back of your mind when you're thinking of treatment.
Wow, thank you. That's really, really interesting. And I'm curious a bit about the personality types. Like, how do you see it clustered? What kind of traits do more people who have ADHD exhibit, maybe more so than the population that doesn't currently have a diagnosis of ADHD? What are those similar personality traits?
Well, so a lot of people with ADHD have a period where they are either without diagnosis or they've kind of been diagnosed, but they're working through like how they're going to regulate, especially as they're growing up with it, or if they were discovered as an adult, there's a whole period where they had to cope on their own, and how they cope on their own can tend to affect the kind of personality they show. So it's not uncommon to find people with I wouldn't say a diagnosis of avoidant personality disorder, but definitely avoidant behaviors that they show up. If they find that they are not motivated to do whatever task it is that they feel is overwhelming or has like a really dopamine expensive, as I would put it in my practice, they find ways to kind of avoid, or they try to diminish it, or they'll do something to help them cope with those feelings of procrastination.
So there's kind of people like, I know from like my background as a child and youth worker, sometimes people would be like, my kid is really hyper, but that doesn't necessarily mean ADHD. There's a whole list of criteria and a system. It could be that that person might have a diagnosis of ADHD, whether as a kid or as an adult, but there's specific criteria that just go beyond this sort of attention deficit hyper. There's a bunch of criteria needed at the same time for it to be ADHD. It doesn't
Absolutely
mean just the personality as such.
Absolutely, and you know, I tell people in my practice, whether you have a diagnosis or not, it's important for medication, but for psychological treatment, if you're dealing with executive function problems throughout your life, that is also a problem. But if you have it kind kind of persistent and have it affect the quality of your life and your ability to function, and you fall under ADHD, there's research backing up how to approach that you benefit from, because you likely fall into the population that these studies were done on. So and I would add to that there's such a large content dump now for ADHD on social media. And on one hand, I'm happy to see that, because some people are discovering that they have this disorder where they might have, falsely attributed it to being lazy or being somehow different. And it's also not ideal, because everyone has to deal with executive function in order to live their life. And if you have days or moments of poor executive function, that doesn't mean you have ADHD. It might mean that's something you have to deal with, but that doesn't necessarily mean you have ADHD. But would you find something on TikTok relatable? Possibly. So it's why I recommend people don't self-diagnose. But if you're dealing with something that you want help with, psychotherapy is pretty much always a good option, because it's not dependent on a diagnosis to receive psychotherapy.
Always ask for help. Maybe the answer is a bit different. Maybe it's not a diagnosis, but that's the first step into understanding a bit more about yourself beyond sort of that, realizations with social media.
For sure.
Awesome. Oh, it's fantastic. Really excellent answer to that question, John. Are you ready for the next question?
I'm maybe as ready, if not more ready, than the last one.
In Family Feud style, here's the second most asked question on the internet about ADHD. Who does ADHD affect the most?
So, I think I have to preface my answer with acknowledging that this is a disorder that has kind of a subclinical population. So what that means is that they don't quite meet the criteria. They aren't nearly as obvious. And there are some conditions that are so kind of obvious when you see them. Like if someone has vitiligo, which changes your skin color, boom, you recognize it right away. This is one that can kind of go unrecognized, because until it starts to really affect a person's life negatively, whether it's school or socially or work, you're not going to notice it. So there seems to be a kind of double distribution for the hyperactivity subtype in boys, and then you'll see that twice as much in boys, but then there's this kind of understanding that the inattentive type goes undocumented very often in girls and in women. And there's been a lot of interesting theories of why that is, but I'll leave it at that. It's important to note how heritable ADHD is. So one of the number one things that you can look at is family studies, where they see what are the odds of someone getting ADHD when they have an ADHD, a member of their family suffering from it, or a set of parents, or one of their parents, and there seems to be a high transfer rate of ADHD. Does that mean it's completely genetically based? We're not so sure about that. There seems to be a lot of different factors, but that's something to note, that if you have a family member, there's a higher chance of you getting it.
Interesting. And just as a side question, perhaps from my own curiosity, because I'm really interested always, about relationships, and how does ADHD affect relationships when one or both partners have a diagnosis? Is that something you're seeing popping up in the literature, and maybe colleagues who do couples counseling, or maybe from your experience?
For sure. So a lot of the people who I work with who have ADHD, it tends to not only affect their relationships, but their relationship tends to be one of the things that prompts them to come in now versus a month ago versus a year ago. Because what will happen is they will have coping strategies that help them kind of trudge along in their life, and it's going mostly okay to really great. And then those coping strategies will kind of hit against someone else's comfort zone, and they'll wonder, well, why can't you just do it like this? Why can't you just pay attention to this. Why can't you be more organized? Something like
Right.
that. So yeah, it'll definitely affect relationships a great deal. A relationship where both partners have ADHD manifests in so many different ways that I could see someone, just because we're talking about ice cream doesn't mean that chocolate and vanilla are the same thing. So I think that if two people manifest so differently with their ADHD, there could be clashes because you might not have problems in all aspects of executive functioning, and those things might not overlap. So you might wonder why your partner is doing it this way and not that way if you're both dealing with the same condition.
And even then, it might not be just chocolate or vanilla. It might be Cherry Garcia, right?
Cherry Garcia, yeah.
Top tier flavor, S tier.
Chocolate chip cookie dough. I don't know what the chocolate chip cookie dough of ADHD is, though.
I don't know. We'll get there. More research needed, right?
Absolutely.
So, I think that lays a really, really great groundwork of sort of an understanding of ADHD for maybe people who are, scrolling through social media and learning about ADHD. I think, like for me as sort of your everyman, it's really interesting to hear sort of the background. And now, on our topic today, which is medication versus therapy in the treatment of ADHD, I think it's a good idea to spend some time talking about medication and the treatment of ADHD. So, when is medication used in the treatment of ADHD? And what are some of the kinds of things that people might notice when starting medication?
So, medication is considered the gold standard for treatment for ADHD. That isn't to say that it doesn't benefit from therapy. It's just something that is considered to be the first line treatment when you're talking about helping someone with the condition. What you would notice when you start really depends on the type of medication. The classic kind of division of the medications is stimulant and non-stimulant medication. So some stimulant medications would include amphetamine salts and methylphenidate, otherwise known as Adderall and Concerta. And these are medications that have a fairly short effect window. They also do have versions that are kind of extended release and allow you to benefit from them all day. But these aren't medications that you're going to take once a week and be fine. These are medications that you're going to take on a daily basis. And what you'll notice is it'll give you a large kind of bump in your attention. So the way I will start describing it to someone is when they are starting a task, the ability to start that task and the energy required to start that task is now a lot lower because the medication is doing a lot of the heavy lifting, and that's because it holds on to the brain chemicals in the communication pathways a lot longer than they would actually be there normally. So you're not trying to kind of recreate that effect all the time. It's basically just ongoing. An analogy I can use is that ADHD can be described as you have a bunch of balls that you're trying to put into bins, and the ADHD tells you to put it all in bin A and bin C, but you really wanted to have it in bin B. Now, the medication, in large part, will help you have more balls to work with, but it won't necessarily tell you to put it in B. That's usually what therapy is good for. But in terms of your ability to be paying attention, your ability to be calm, your ability to regulate, the kind of the capital that you have to use for that, medication is really good for that. The other medications like non-stimulant medications work similarly, but they don't have that kind of initial effect where it then disappears that same day. It'll sort of build up over time, and it doesn't have the drawbacks of the stimulants, which is they have a known addictive quality to them, as an amphetamine derivative would most likely have.
So that's interesting. So it actually brings up a question that I've been wondering about, which is, does addiction, is there a higher proportion of people of ADHD who struggle with addiction or who may be more susceptible to addiction to either the medications that would be supported for ADHD, like an Adderall or a Concerta, or even something like alcoholism or substance use?
It's a really good question. So there are a higher, you are at higher risk for having a substance use disorder if you have ADHD. There's an ethical question, of course, of like, is it okay to avoid a certain type of medication just because someone has addictive tendencies? I think it's worth debating. I know that in a lot of cases there is a discussion of maybe starting with the non-stimulant medication since those options are available, but it's really a case-by-case basis. I think that if someone is overcoming a different substance use disorder and then you're presenting them with a stimulant and that may put them at risk for relapsing, I think that it's a worthy consideration to talk to them about non-stimulant medication or therapy. But thankfully I've left that realm behind. Now I get to see the people who have decided to take the therapy route, and whether they're on medication or not, I do my best to help them.
I think it's worth saying too, like as we're having this discussion, because it's and we've spoken about this before, and I've spoken with a lot of clinicians about it before as well, which is that it's often not medication or therapy. Like going to see a psychotherapist, understanding the therapy that might be the best prescribed for a specific concern is important. Going to a doctor or a psychiatrist to discuss those specific concerns, it's important to share like, oh yeah, like, hey, I'm also struggling with some substance use concerns. Let's talk about that, because that helps to influence and like share with the psychiatrist all of the different pieces holistically that you're going through, so that they can help support to make a good choice and look at you as an entire person, not just as ADHD client one, right?
Absolutely, yeah. I was reviewing the literature this morning to see if I could share anything interesting, and recent studies have shown that it does appear that like treatment with CBT together at a 3-month follow-up is more effective, and then if you ramp up treatment over time, it's suspected that it'll be similarly effective. But that kind of first initial "you've been diagnosed, now what?" question shouldn't be a question of do I pick one of these. It should be, I'd say, hedge your bets, do both, because that's what the literature suggests is the most effective.
Absolutely. So that's medication. Let's take a bit of time and dive into question 4, rather than me saying, are you ready once again for a 4th time, even though we did it anyways, which is, what types of therapy are useful in the treatment of ADHD? Is it CBT? Are there different behavioral therapies that are effective? What's the scope of therapy in the treatment of adult ADHD?
So a lot of the psychotherapies have been shown to have some positive effect, if not a moderate one, then a weak one. But CBT also does have the benefit of having the most literature done on it. In this case, in particular, but in most cases, and CBT is actually shown to be quite effective in helping people navigate ADHD and benefit both in a reduction of symptoms and just a reduction in general distress. I would say that there's definitely no requirement for it to be CBT, but if you're trying to go for the most evidence-based treatment currently, it would be to go with cognitive behavioral therapy. The cognitive behavioral therapy will probably have been modified to have some executive functioning coaching in there, some psychoeducation in there, behavioral strategies, cognitive strategies. So it'll be a little bit more integrative than maybe just plain Jane CBT. But nonetheless, CBT seems to be the most effective, although there have been studies done on other ones like biofeedback and some humanistic therapies and psychodynamic therapies as well.
So when researchers, and I'm not sure if you have any insight to this, but when researchers are researching and saying, okay, cool, we have CBT, it's been evidence-based for a long time, but we have this whole, there's a lot of people who are struggling with ADHD, and maybe CBT is good, but it can be better. Like, what are some of the steps these researchers are taking to say, oh yeah, we want to throw some executive functioning coaching in there. Oh yeah, we want to throw this kind of psychoeducation. Is there like a trial period and then they roll it into some studies? What's sort of the process there?
Yeah, so it's kind of a double-edged sword because we are kind of in this like amazing pioneering time in both in CBT in general and CBT for ADHD. There's been a big push now for mindfulness-focused CBT, and that's been showing to have some pretty good effects on people with ADHD. And so when people are trying to research these new strategies in CBT, they'll create a protocol or they'll try to create something that is replicable and something that can be studied well. The downside is that it because everyone has good ideas and everyone wants to see what'll work, the manual for how to do CBT is so varied now that you might get these very heterogeneous studies. So you'll get these studies that it's not that everyone did the same thing exactly, or you'll get these studies where, you'll get these set of studies. Within the study, everyone's doing the same thing. But if you're comparing studies, they didn't do it the exact same way, or they didn't work with the exact population, or the measurements weren't exactly the same. And so it's hard to say, like, if we take all this data together, do we have a good effect? The good thing is that because the effects seem to be pretty consistently good throughout all of these different experiments and these different studies, it's you can trust at the very least that CBT isn't doing any harm and that it's worth trying because you might be able to recreate the effects in some of the studies seen, if not all of the studies, which would be ideal.
Awesome. So CBT is the way to go, and as time goes by, there's more and more versions or permutations of CBT that are addressing ADHD maybe more specifically.
Absolutely, and there's this idea that CBT doesn't really affect ADHD's core issues. Rather, it affects the results of those issues. So I'll give you an example. So if you're the type of person who is going to have a lot of avoidance because the idea of doing the thing that you're supposed to do is really cognitively taxing. It just sounds like you're going to have to think through it and it's going to have a lot of steps. The CBT is going to help you deal with breaking that task down so it matches more to things that you would naturally do without really having to think about it, like going to mow the lawn or brush your teeth or something like that, where it's just so physical and manual and rote. So instead of go write that paper, it'll be go turn on your computer, and that'll be dealing with the kind of manifestations of ADHD. What it won't do is it won't suddenly make you a more attentive person inherently. It'll just teach you how to compensate for who you are. And if you have the benefit of medication, how to direct the benefits of that medication to capitalize on what it is you're taking.
Awesome. So before we get to sort of our last question, I have another previous to the last question. I'm really curious about this on the therapy piece side of it, which is what are challenges to expect in therapy if you have ADHD? If you're coming, you've decided, hey, I'm going to give therapy a try. I've gotten maybe, I've spoken to a doctor. We agree that this is the way to go. What are some barriers to entry, but also in the actual therapy itself, what are some challenges to expect?
So that's an excellent question. So I'll start with the stuff that's universal to therapy. So I tell people when they're starting therapy that therapy has a tendency to make people upset. We're kind of unearthing deep-seated problems, and we're looking at them and we're dealing with them, and that's a very emotionally charged process. And until you start to benefit from the actual work of therapy, it can be a little bit challenging to overcome that. And that lack of immediate gratification in the context of someone with ADHD kind of feeds into the poor executive function, because this is your ability to say, I am doing what is hard right now because it's right for me and it's helpful. And if you don't have that kind of built-in ability to do that, therapy is going to seem really challenging. Now, the way to overcome that challenge is to have a therapist who warns you of that ahead of time and tries to sew in early benefits into the CBT practice, so you're seeing benefits very early on, and you can kind of build on those improvements and then have the bigger obstacles be something that you chip away at over time, as opposed to trying to do the big things right away and having weeks of no real change or benefit.
So a therapist will structure it differently to help create, hey, like, this is a result that we were able to accomplish together and work more upfront maybe than with other clients.
Yeah, and so like one of the early benefits that I'll imbue in my CBT practice with people with ADHD is psychoeducation that's very validating. So I'll explain to them that they're not lazy, that they're not bad in any sort of way, that they're not worse in any sort of way, that it is a neurodivergence. It is a disorder because it is classified as such in the DSM, but functionally with the number of people that are dealing with it, it is just kind of one type of way of being in a world that isn't necessarily super well designed for that way of being. That is not a reflection on the person who has it, but that doesn't mean that you can't game the system a little bit to make it easier to live in this world with ADHD, or even to thrive in it.
Love that. So, John, before we get into our final question of the episode, I'd love if you could tell the listeners where they can find you, maybe learn a bit more about your psychotherapy practice, and maybe something that you're working on currently.
For sure. Yeah, I am with a clinic, Rolls and Associates. We're in Sudbury, Ontario, but we have virtual clinicians and do virtual sessions with people all over the province. I also host a show called Feeling Therapeutic that can currently be found on YouTube under the Rolls and Associates channel. And it's a show where I talk with clinicians in my practice about emotions that are commonly discussed in therapy, and what the benefit is of discussing those emotions, and how people tend to struggle with those emotions. We have an episode on anxiety, an episode on disgust, and we have many more on the way coming down the pipeline.
It sounds like we have more to discuss together. No, that was awful. That was a bad segue.
Oh, was that a pun? Oh, that's good.
Yeah.
No, that was funny. That was good. I missed it. That was on me. That was a good pun.
But yeah, for all the listeners out there, Dr. John's one of the greats. So definitely check out the podcast, Feeling Therapeutic, and Rolls and Associates if you're in the Sudbury, Ontario area or beyond. So, Dr. John, we've made it this far. Are you ready for the last question?
I am somehow more ready than I was for the first question.
Perfect. I've only asked if you're ready 3 times, so we're good. This is a good start.
That's an appropriate amount, I would say.
Feel so. 3 out of 5 ain't bad.
Sure.
So we've spoken about therapy. We've spoken about medication. What is the future of ADHD treatment? Like, what's the mix, do you feel, or from the literature, of medication, of therapy, and where do you think things are headed? I know we were alluding to it a little bit before, but I'd love to go into a bit more depth about it.
I think ADHD is an interesting condition to talk about the future of, because in some ways it's also discussing the future of kind of classifying it and understanding who has it and who would benefit from treatment. I think that based on how things are going with the DSM, it does seem that things are expanding on who they will classify as having as ADHD. The research suggests that there's a lot of medications coming down the pipeline. A lot of medications are being tested to see if they will help not just with ADHD in general, but for example, I read a study on a specific therapy helping specifically with inattentive symptoms of the disorder, and and a certain medication also helping specifically with inattentive symptoms, because that tends to predominate how adults experience being having ADHD, because they're not sitting in a classroom anymore. More so, they can move around freely, but they have to sit down and muscle through a project or an assignment or something like that, and that seems to be the biggest challenge in their life, as opposed to being trapped in a room surrounded with children their age, which is obviously a much more going concern when you're younger.
It's a very different problem.
Yeah, absolutely. Yes. And yeah, so I think what's coming up is really trying to tailor the medications for the different presentations of ADHD.
Yep.
And for psychotherapy specifically, I think that psychotherapy will benefit from kind of expanding its circle of what integrative therapy, what combination of CBT and existentialism and psychodynamic therapy, what kind of confluence of those different techniques will be best suited for people with ADHD.
So great. Dr. John, it's been an absolute honor and a pleasure to have you on the show. If you were to leave the listeners with one piece of advice around starting their own journey with therapy, what would you tell them?
I would say that your best bet is to understand that 40% of what you benefit from in therapy is your relationship with your therapist, meaning that find the therapist that you feel like you gel with and work well with, and the rest may indeed fall into place for you.
I love that. Just leave the listeners with one thing. Recovery is possible, and EHN Canada is a place for both virtual and inpatient treatment programs for mental health and addiction. To learn more about EHN Canada and how you can begin your own recovery journey, please go to ehn.ca. To listen to even more episodes of the 5 Facts podcast if you enjoyed this episode, firstly, give us 5 stars minimum. And secondly, you can check it out on your favorite streaming platform, Spotify, Apple Podcasts, Google, and our website at ehn.ca as well. Thank you so much, Dr. John. Thank you, listeners, and we will catch you next time.
Thank you.